Hi, I'm Patricia Greenberg. Today, my guest is Dr. David Daniels. He's a plastic surgeon based in Summit, New Jersey. And we're going to talk today about all the aspects of wellness in your skin and your appearance. And certainly since the advent of COVID, which led us to be a Zoom culture now, where we're online all the time, we're going to talk about how to feel and look your best there as well. Dr. Daniels specializes in cosmetic, plastic, and reconstructive surgery, and his practice also includes many aesthetic options. And we're going to talk about that: lasers, fillers, neurotoxins, skin care, fat reduction, skin tightening, and more. Welcome, Dr. Daniels.
Thank you for having me, Patricia.
I want to start out by expressing the growing concern among the aging population that plastic surgery is detrimental to pro-aging. Let's talk about that for a second. I see it as enhancements, but a lot of people see it as it's actually making life harder for people to age.
Well, what you have to look at is really that the purpose of what we do should be to restore what people used to look like or to improve it, but not to just fill.
Yeah.
Unfortunately, there's a lot of people out there that are handed the tools but don't know how to properly use them. And so they end up filling and injecting Botox in areas that they shouldn't be, which then, yes, can lead to patients looking, quote, funny.
Yeah. Do you have people come in that were somewhere else and need to be corrected?
Uh, Pretty regularly.
Oh my goodness. Okay.
Unfortunately, we're going to put in, again, bad Botox. They run to do Groupons, thinking that
Okay.
it's just, they don't look at they just look at, unfortunately, certain things as a product. So they hear Botox and they think, oh, Botox is all the same regardless of who does it. Or the various fillers that exist, whoever does it, it's all the same. They don't look at the expertise of the person doing it. I even have my patients occasionally run off and get a Groupon done, and within 6 months they're back going, I'm so sorry I cheated on you.
Yeah.
And I couldn't come back until it wore off because I couldn't let you see me that way.
It's interesting that what age does the damage really start to show? Because I think, we're all so focused now on aging well. Well, I'm focused on it, and this is what I do. But we want to reverse the ill effects of our previous lifestyle choices, the habits that got us into trouble, the too much smoking, drinking, staying up all night, the things that we know now actually does cause skin damage. At what age does the damage start to show up? I guess the combination on its own, and also maybe you've accelerated it through life. Like, what do you see as the real line of demarcation? 40, 50?
Actually, much younger. If you're talking about just skin, damage starts at a young age, actually. So with children, what you see is they have freckles. And everybody says, oh, they're so cute, but that's actually now the start of their sun damage. And I'll have 50, 60-year-olds that come in and still think their freckles are cute.
Right.
When the average person looks at them and just thinks their face is dirty. That's when it comes to skin. When it comes to structure, I think we all maintain our structure till somewhere around 25 to 27, 28 years old. After that, our bony structure starts to also decline.
Wow.
So everybody who's older always says, oh, I'm shorter. In the past, we used to think that jowling, which many people complain about, came from gravity and loss of cheek volume. But the reality is that it actually comes from bony loss. It's the shortening of the mandible. So if you were to take the front of the chin and measure it out to the back, the angle of the mandible, that patient has shortening of the bone. And if you look at the dead center, that's where the jowling is hanging. So there are ways to restore that without actually having to undergo the knife, just use of a needle and a cannula.
Interesting. So what would be your approach, where a patient comes in and they want anti-aging advice and they want these subtle changes? I mean, if it's the bone that's diminishing, the skin has less bone to fill out under, I guess is what you're saying, right?
Correct.
So what would you do with that? What's the first approach to that when someone comes in and says, I don't like the way my face looks. I look like a
Well,
puppet.
there's two different issues again. One is skin,
Hmm.
and the other is the structure underneath it. So one of the analogies I give is you have a nice present. The present is in a box. That box is your facial structure. If the box is dented and you wrap it in nice wrapping paper, it still will look dented.
Right.
Paper might be nicer, but the structure is not there. On the other hand, you could have nice structure, but if the wrapping on the paper is all crumpled up and then the gift is wrapped, does that look nice either? No. So they go together. A patient coming in for their first time that hasn't actually done anything, I will take them and usually start them on a skincare regimen to help build the elasticity of their skin, get their skin more responsive, and then address the structural issues after. But doesn't mean you have to wait long. It's just that you do want to address both causes. It's not oh, my skin is wrinkly. Well, why is it wrinkly? You have to look at it at the grand scheme.
So I know many people now are working at home and, they still need to look good. So they're going to come in and I'd imagine people want quick fixes. I mean, the way you just described that is amazing. I think I'm so savvy with this. I didn't realize there's like two separate issues that you could deal with, that isn't a facelift, which I want to ask you about as well. So, now we have this pandemic, like, are you are fillers and neurotoxins quick fixes?
Generally, they are. They're fairly instantaneous. You do
Okay.
see the effects of them. With fillers, there is we're going to call a swelling period immediately afterwards, to which you have to recover from. Usually it lasts a couple of days and it's gone. With Botox, it could take up to 3 days to take effect
Okay.
and a week for maximum effect. So, yes, they're relatively immediate results, but it's not instant. You still have to wait a few days.
So what would you use Botox for? I know the number one is to minimize the crunching in the eyebrows and the appearance of frowning.
So, Botox is used to soften lines, but it's not as a filler.
Mhm.
Many people think that you inject Botox and it's erasing the lines by filling those lines, and it doesn't. Botox is a muscle weakener. So it stops the exaggeration of those expressions which cause those lines.
Okay.
Fillers, on the other hand, are directly filling that volume difference, and depending on where you inject it, can also affect the results of it.
So here's the big question. Tell me about the safety of both the Botox and the fillers.
Both are very, very safe. It's not to say that complications can arise. You do need to be conscientious of anatomy.
Mm-hmm.
You have to know where vessels run, because also inherently, especially more with fillers, if you inject into a blood vessel, that can be detrimental to the patient. One of the areas I don't like injecting around is the nose. I know that the liquid rhinoplasties become very popular, but that does have a lot of inherent risks.
Okay. Now, what about the Botox in the neck? I've been hearing that people are using it to tighten up their neck.
So what it does is it helps with the platysmal banding. If you're somebody that uses that neck muscle really, really strong, it can help relax it. But again, a lot of the neck issues are from bony structure loss in the mandible, which allows things to relax, and also skin issues. It's not, Botox is not going to help the crepey skin. It's just going to help the banding that occurs vertically straight down the middle,
So is that
on
a
either
common
side.
procedure? Do you recommend that to lessen the amount of sag here?
Usually I go with fix the structure above it first, and then
Okay.
we'll work our way down.
Okay. Okay. Interesting. Um, I I'd love to hear about, the procedures that are, safe, affordable, little or no downtime, but really give good results. I mean, that's the golden standard. We want the least amount of problem with the best results. What do
Uh,
you do for
first
that?
is first is always skincare.
Okay.
That is your biggest bang for your buck.
Okay.
Um, it does require a patient to do it. They can't just buy it and let it sit on their counter.
Mhm.
But you can tailor the system to even what that patient is willing to do. I have patients that want to only do 2 or 3 steps,
Mhm.
one of which includes just washing their face and applying sunscreen in the morning.
Okay.
So that's 2 steps right there.
Okay.
And I have others that would love to do an 8 to 10 step regimen twice a day.
Mhm.
So you have to try to make it work for the patient. With that said, after that, then you start getting into fillers, radio frequency microneedling. There's a new device out now called M-Face, which is high fem technology to increase muscle stimulation so that it helps lift the muscles of the cheek and of the forehead and your smile, called the risorius, out to the side to help turn the lip up. Um, and those have relatively no downtime.
Okay. Tell me about the microneedling. That's a very big hot topic now.
So there's home microneedling, which I don't recommend at all.
Okay.
And then there's what we do in the office, which is radio frequency microneedling. The device that we use for it is called Morpheus, and it's an amazing device. It does both a mechanical trauma to the skin,
Okay.
which your body needs to heal by then stimulating collagen production, and also delivers radio frequency energy, which is heat, to the various layers of skin on a patient to help tighten up that skin and stimulate that collagen production as well.
And how long
Um,
do the results for that last?
so that you get an immediate response,
Mhm.
some tightening, some lifting. With that, we usually recommend 3 treatments that are 1 month apart,
Mhm.
and then you see results out for 2 to 3 months afterwards in terms of improvement. How long do they last? Again, that comes back to how much does that patient take care of their own skin?
Ah, okay.
If they're doing skincare, that result will last much longer. If they don't, then it's from that 3 months out, things will then start to deteriorate again.
Okay,
Um,
let's talk about skincare for a second, because I also want to get on to talking about there's all the camera filters in the world to make you look good in pictures and TV and Zoom, etc. But I want to talk about what we can do to enhance that. Um, so here are the hot topics that everybody's doing, that you absolutely cannot go to bed without makeup on, that you must wash your face every night before you go to bed. So the hot topic now is vitamin C, um, vitamin C serum, and retinol
so vitamin C serums typically should be used in the morning,
in the morning.
not
Okay.
at night.
Okay.
Um, the one concern with vitamin C serums is if somebody's prone to breaking out, vitamin C serums are actually not a good thing to use. It will actually increase the breakouts.
Okay. Okay.
But other than that, it's a great antioxidant. It does help with sun protection. So I do love vitamin C, but you have to have the right patient using it. In terms of retinols, a good quality medical grade retinol is awesome. It
Mhm.
does penetrate the skin on its own to the deeper levels. However, most people who buy retinols buy the over the counter ones that aren't microencapsulated. And once those retinols are exposed to air, they start to break down immediately. So again, using a good quality retinol. In my office, we tend to use one of 3 forms of retin. One is retin A in various different strengths. The other is retinol, and there's a newer product called a retinaldehyde, which is a product called Retivance. Retivance can also be used on its own, does awesome with fine lines and wrinkles, doesn't cause any flaking, just some mild redness, and is an excellent product as well.
But it's only available in doctor's offices.
Yes.
Okay. So what about moisturizing?
Moisturizing is actually a big no-no.
Really?
The cosmetic companies have us all suckered.
Okay.
Um, Generally speaking, moisture or moisturizers should be used for rescue, not for just applying to feel better. If you don't apply, your skin generally will figure it out. But what's happened is that over the decades now, the cosmetic companies have come out and said, you need to be applying moisturizers. And if you actually look at most women, they're the ones that are applying it.
Hmm.
They're also the ones that, in the course of time, feel more dry.
Mm,
Men don't apply moisturizers for the most part. And most men aren't complaining about feeling dry in their
that's
lives.
true. That's true. That's very interesting.
So if you use them, you build a dependence to them. If you don't use them, your body will figure out how to moisturize itself. Again, it's not to say there aren't times the forced air heat comes on and there's no humidity outside that you may need a little help, but that's all it should be. It should be a rescue, not a daily use product.
That's very interesting. So, so the regimen in the morning and the regimen at night can actually be very easy, very simple to
They can.
yeah. How do you like moisturizing, tinted moisturizers and foundations that contain sunscreen? Do you have a very
I,
specific take on sunscreen?
yeah, with sunscreens, again, I tend to go more towards the good quality products. I prefer sunscreens that have physical blocks, such as zinc in them.
Mhm.
Um, the zinc does not have to be that heavy white
Right.
paste that goes on. We do have sunscreens that contain zinc in higher concentrations, but that zinc is micronized. It's in small particles, and so it blends in nicely. Um, we have even tinted ones, but that's different than using a moisturizer that contains sunscreen.
Right.
Those moisturizers that contain sunscreen are unfortunately generally really not good products at all. If you go online and even look at the reviews of them, when reviewed by the FDA, they all pretty much fail. If you look at a sunscreen, the way I equate it to my patients is like a radio. You have AM, you have FM, and now you have XM, and that could be your UVA, your UVB, and UVC radiation. And within those parameters, there's multiple different wavelengths. When a sunscreen claims UVA, UVB protection, or UVA, UVB, UVC protection, they're only obligated to partially cover part of that spectrum to make the claim. So if you look at it as a radio station issue, it could be blocking AM from 1010 and above and nothing below,
Okay.
and your FM from 89 up to 93, and that gets UVA, UVB. They can make the claim, yet they're missing a lot of the spectrum. And so those people still get burned and still get sun damage.
That's a very
Um,
interesting analogy. So what we all, we're all worried about looking tired, right? That seems to be the number one complaint, that people feel old because they feel like they look tired all the time. They want to look refreshed, they want to look awake, and they don't want to look fixed. So this is where, I hadn't really put this on the Q&A, but I'm now that I have you here, I want to ask you, talk to me a little bit about a facelift.
so,
Because I have friends, I'm 62, I'm very proud of my age, and I tell everybody how old I am. And I always say, if I was going to have a facelift, I would want to look 20 years younger. I wouldn't spend
so,
all that time and energy just for a little subtle, I look like I got a good night's sleep. So
so
what's the spectrum in facelifts, I guess is what I'm asking.
that's a great question. So
Mhm.
when you look at a lot of patients, people in society in general, in the past, around 45, women were running out and getting facelifts.
Right.
And a lot of that entailed, we're going to say, taking away just some extra skin from behind the ear, tucking it all back along the ear, front and back, and closing. Everybody always felt that those people looked funny afterwards. Okay, they looked pulled. And in a lot of cases, 9 months, a year, we could even say 2, 3 years later that they look the same, or that that sagging came back, the jowling came
Mhm,
back.
mhm.
You have to look at it from a different perspective. In our society or in life, when does skin actually grow? Skin in women grow as they're aging from 0 to 20. In men, same thing. Um, it also grows in both cases when people get fat. The only other time that skin grows is in the case of women when they get pregnant.
Mhm.
So you don't really grow extra skin after you're at 20 years old unless you've been chronically overweight.
Okay.
Those patients not only have extra skin that's been expanded out like a tissue expander. So when you have your patient that's had gastric bypass and then rapidly loses weight, that skin tends to hang. That patient requires a facelift. But again, going back to that bony structure loss, most patients, the issue is actually, yes, they had a little tissue expansion, their skin quality wasn't so great. A lot of those things can be corrected subtly without surgery. The bigger issue again comes down to bony loss.
Mhm.
So what you want to do is restore those areas like the angle of the mandible or the body of the mandible where they've lost that structure, put the structure back, and then they don't need a facelift and they
Okay.
don't look funny afterwards.
But you do facelifts.
I do them, but again, as time has gone on, the requirement for it has significantly decreased.
And
Patients don't need it.
do you find that there's an age in which none of this works any longer, or you can come in at 70 and 80 and
So
get a
the younger you start things, the better you do. It's always easier to maintain and turn back a little
Mhm.
than it is to turn back the clock 20, 30 years.
Right.
That's much more difficult. So the person who hasn't done anything along the way is going to require more things to be done, but there is no turning a 70-year-old back to 30, 35, 40 right now.
Well,
However,
that's where I wanted to ask you, how realistic are the patients when they come in? And does anyone come in at 60 and say, make me look like I'm 40?
no, most of my patients come in and just say, I want to turn the clock back a little. I
Okay.
want to look more youthful, but they're not trying to make themselves different.
Okay.
The ones that want to make themselves different are the ones that you have to watch out for
Yeah.
because you'll never make them happy.
Mm.
And it doesn't matter what you throw at them, they will still see themselves as that person that they were coming in before.
Right.
So, with that said, even it's important I take pictures of everything because I've had patients that will come in who don't even recognize their own improvement. And with these pictures, you show them their befores and afters,
Mhm.
and then they see it and they go, oh my God, you're so right. Because these transformations also aren't necessarily next day.
Right. Right.
It's what they're seeing 2, 3 months later, 6 months later. So even with that said, for body, we have a device that's called Sculpt Neo. It's a muscle building and strengthening device. You do get some fat loss, you do get some skin tightening with it as well, but I look at it more as strengthening. And I've had patients that will do it on their abs, and a 30-minute session is the equivalent of 20 to 25,000 crunches
Oh my
in
goodness.
30 minutes.
Mhm.
Because when you're exercising, you're only capable of activating about 30% of your muscle fibers. This device is engaging 95% of your muscle fibers. Um,
Is it painful or agitating during the procedure?
no, it
Okay.
just feels like you're doing crunches.
Okay.
Just you feel the stomach muscles
Yeah.
contracting,
Okay.
and you can dial it up or down to patient comfort.
Okay.
Somebody who's actually more out of shape is more likely to be able to tolerate more because their engagement of muscle fibers isn't going to be as aggressive.
Mhm.
So I have patients that are really fit that come in and can only get up to 60, 70% on the device. Whereas my heavier patient says 100, no problem. We
Yeah.
keep going. But with that said, they do their treatments. And I had one patient as an example, came in after 3 months, said, doc, my stomach, it feels stronger. But photo wise, looking in the mirror, I don't really see anything. Well, why? It was a 3-month transformation.
Mm.
When I pulled it, I said, oh, let's take those pictures and just take a look. Took her after pictures, pulled them both up on the screen for her, and she looked and she said, oh my God, can I do another treatment now?
Mhm.
She just got used to looking at herself in the mirror. Didn't notice that she noticed even clothes might have been a little looser, but not that the clothes that was hanging over her pants was
Mhm.
hanging over before, and now it's not. Now it's a nice straight line down. It's not that it gave her a six pack. It just helped tighten her core. It also
I
actually in
think,
her
yeah, this is very profound because I think this is what happens is people have a warped perception of themselves in both directions, right? That
yes.
they don't see the improvements, or they may not be acknowledging that any kind of decline. Again, we didn't talk about this offline, but I want to, if this is a short answer, as we're getting closer to time, I do want to mention I'm
Sure.
Patricia Greenberg. You're listening to Eat Well, Live Well, Age Well, where we talk about all things aging well. My guest is Dr. David Daniels, a plastic surgeon, and he's affiliated with Overlook Medical Center in Summit and St. Barnabas Medical Center in Livingston, New Jersey. We're talking about the most effective surgical and non-surgical invasive procedures, non-invasive procedures, as options for patients who are aging and hopefully embracing it to achieve realistic results to feel good about themselves. Now, I wanted to ask you about gray hair.
Okay. Go
So
ahead.
you turn gray at a certain point, the pigments are lost. Do you do any sort of hair restoration, or is there any magical potions to work with that?
So there is actually a new device that just came out about 6, 7 months ago. It's by a company called Alma, and the device is called TED, and it's spelled TED.
Okay.
TED is completely non-invasive. It stimulates the actual hairs that are physically there to become thicker, healthier, more dense, and also hair that seems to have, we'll say, disappeared over the last 10 years or less to actually stimulate those follicles and cause regrowth of those hairs from what we can see in the office. Um, Photographically, I have actually noticed that some of those hairs have also become darker.
Okay.
I don't have a scientific explanation for it. And I've
Okay.
approached the company and asked them. And as of now, they don't have an explanation either. It's not to say that white hairs will become dark and
Yeah.
black or brown,
Mhm.
but the overall visual of the visual appearance of hair seems to become darker with use of the device. And the nice thing is, it doesn't hurt.
Right.
There's no blood draw involved. There's no needles involved. It's a simple 30-minute treatment, 1 month apart. You come in the office, you sit in the chair, we take photos, we mark you out for what we're going to treat, and you get your treatment done. And there's actually no downtime either. You can go to the gym right afterwards if you want.
Okay. Okay.
Our only request afterwards is don't wash your hair till the next morning. That's it. And
All right.
it seems to be working great. I had a big cowlick in the back of my head, and we actually posted our pictures. Um, it's gone. Nothing there.
Wow.
So
Wow.
it works. It's
Interesting.
awesome.
Wow. Now let's talk about, in closing, what can we do today to live better lives and reduce our risk of damaging our skin going forward?
So important things. One, hydrate, drink water. That's really, really important. Um, eat healthy,
Mhm.
try to eat less processed foods, more vegetables. I'm okay. I know some people are very anti-meat. I'm
Mhm.
okay as long as it's a balanced diet.
Mhm.
Take your veggies, proteins, meats, sources of protein in, but I'm beginning to believe more in the less processed is
Yes.
better than more processed.
Mhm.
Avoid sugars if you can. And that even goes with the artificial sweeteners. I think that they're actually worse than actual
Mhm.
organic cane sugar.
Mhm.
The whole diet push, I'm not sure is a great thing. I think it's important also to have healthy fats in our diet. I know that there was a big push, saying that fat was bad for us, but I think that a certain amount of that's important in our diet to help support our gut, help support uh, necessary hormones within our own body to produce testosterone and estrogen that we need. Um, all those things are important. And then, of course, a good quality sunscreen for your skin. Exercise is always important. And after that comes your skincare, lasers,
Mhm.
fillers, Botox, but those are all add-ons. You have to have that healthy start first, and then these things are all add-ons. I actually wanted to mention one other device that we do carry in the office. It's called Emsella.
Okay.
It's referred to as also the Kegel throne. It's helped both men and women. With women who have stress incontinence issues, it's been life changing.
Really? Wow.
Most patients come in 6 to 8 treatments. They sit on a chair, dressed, nothing invasive.
Hmm.
30 minutes is the equivalent of 11,200 Kegels.
Wow.
And really, I've had patients that were really having problems even with having to change pads at night multiple
Mhm.
times, during the day multiple times, and have now come in and said, my God, I can actually sleep through the night without getting up. And I'm dry.
Wow. That's really
Uh,
something to explore. That's really interesting.
yeah, when it's mild to moderate issues, jumping jacks, coughing, sneezing, they're
Yeah. Yeah.
essentially cures.
Hmm.
It's a cure for them. I've had patients that didn't know how to do a Kegel and were
Mm.
having those issues. And it actually has now taught them to be able, they know what to feel so that they can then do it on their own. And again, that comes back to maintenance because now they know how to do it. They can then do those exercises on their own at home and thereby decrease the need to come back in and get retreated more frequently. But
And the Kegel
that's a
exercises
life
should
change.
be, yeah, it's amazing. And that should be done every day. The Kegel
That should be done
exercises.
every day.
Okay.
Patients can do it at their 5-10 second stop at the stoplight. I have
Yes.
a patient that
Yes.
came in and said that's what she does.
Yeah. Yeah.
Um, when she stops at a stoplight, she does her Kegels then. Um, for men, it's helped them also, especially after prostate surgery,
Mhm.
where they have issues with stress incontinence and ED.
Right.
It's helped
Right.
them by strengthening the pelvic floor. It's helped them gain more control. And I also have the occasional patient that's male that comes in and says, my God, doc, it's like I was in high school again. And this
Wow.
is a
Wow.
55-year-old guy. He says, my wife
Right.
says, leave me alone now.
That's a miracle. That's good to
So
hear. So everybody, please reach out to Dr. David Daniels, because this is all life changing. It goes from the conversation you hear plastic surgery or fillers, and it's like, oh, your vein. You just want to. There's so many health reasons
there
and
is.
quality of life reasons why we should look into this. And I just really quickly, how often do we need to get our skin checked for medical abnormalities? Is that once a year or?
At
Barring
least
any.
once a at least once a year. I mean, there obviously if you've had skin cancer or a family history of skin cancer, it might be something that you do twice a year, sometimes 3 times a year if you've had cancer, but at least once a year, a good body check with the dermatologist. Let them check all the little crevices that we can't see ourselves, our
Yeah,
backs,
yeah.
because that's important.
Mm.
You can't check everywhere on yourself. It's just not possible. So I'd say once a year at a minimum.
And Dr. Daniels, can you give us your website again?
Sure. It's danielsgroupnj.com.
Okay.
DANIELSGROUPNJ.com. And my Instagram is Dr. David Daniels
And
as another
we'll
method.
post that on the notes when we put the show up. In closing, I
Awesome.
want to thank you so much for being here today. I learned a lot from you. This is a very informative interview. And I always ask, what do you like about getting older?
Living longer and
Good.
healthier, enjoying my family.
Yeah.
Those
Yeah.
are the important things.
Absolutely. And try to be happy every single day. So thank
That's
you
right.
so much for joining us. Stay well, stay safe. Thank you to the audience for joining us as well. And you have a wonderful day. Stay well, happy and healthy, and happy holiday season to you.
Thank you. Happy and healthy holiday season to you as well, Patricia. It
Thank
was
you.
nice
Thank
chatting.
you. You too.